Hello, everyone. Thank you for joining us for today's interview. I am Candace Paul, founder of Aknowingspirit LLC, a publishing company that is much more than publishing. We build communities online and help creatives with uplifting messages share their vision with the world. I sat down with Marilyn Mitchell, a first time author, to discuss the powerful book she wrote, In the Hands of Her Caregivers. In this book, Marilyn explains how she had to become an army of one, fighting for her mom's best interest against a system that tends to treat patients like numbers. In this emotional interview, Marilyn tells us the hope she has for the book and also shares the memories of her mother. Hello, everyone, and welcome to Aknowingspirit. My name is Candace Paul. I'm the founder of Aknowingspirit, and we are a publishing company that helps indie authors take their book from concept to publication. So today we have the honor of speaking with one of our authors, Marilyn Mitchell. And she wrote a book last year called In the Hands of Her Caregivers. The book is about the healthcare system, or rather the failings of the healthcare system, and what her and her mother had to endure. So Marilyn, welcome. Thank you for being with us today.
Thank you for having me. It's an honor.
Absolutely. You're actually our first interview in a long time, so I'm very glad that you could join us.
Okay.
So tell us, before we get into the details about the book, because I really want to do a deep dive into that, but tell us about who you are and your background.
Okay, so my background, I was born in New York, moved to Grenada at a very young age, and returned after graduating from secondary school, high school in Grenada. My parents were here, so I grew up with my grandparents and an extended family.
Mm-hmm.
I attended Howard University, where I obtained my first bachelor's degree. And then I went back to school after graduating. A few years later, I went back and studied nursing at Montgomery College, and I continued on at University of Maryland, Baltimore. All the while, I was just very active with whatever plans my mother, it seemed, had for me at the time.
Caribbean parents,
So,
yes.
right. And then I continued my education with the graduate degrees from University of Maryland, University College, healthcare administration and business administration. During all that time, I worked as a nurse, registered nurse at local hospitals. So I did some bedside nursing on women's surgery and then the recovery room. So I had the understanding of basics in nursing. And then I moved on to case management. So that would involve like utilization reviews and discharge planning for patients who would be discharged from the hospital and need more care after discharge. So it could be at home or rehab facility. I did that with the hospital, and then I got another position as a case manager, same job, but on the insurance end of it. So then I got to see the other side of it where, the insurance, everything is insurance driven.
Yeah.
And it was during all of that time, then my mother's story was developing.
Wow. And I'm so glad that you explained your background in that detail, because it's very important to the story, because you have a nursing background and you understand a lot of the healthcare system, but a lot of what happened was even new to you, right?
Right.
The story. So tell us a bit about your mom prior to her diagnosis.
Okay, so prior to her diagnosis, my mother, Denise Mitchell, was a very vibrant, very friendly, loving, kind-hearted, generous person. She made friends very easily, and she did her best to maintain or to nourish those friendships, those relationships over the years. She got her daughter involved in every single thing she did. So there was seldom an invitation that my mother turned down as an opportunity to get together with her friends, she was always there. So she
Yep.
loved being around people. She loved to travel. She loved her family. And, you know, her big concern was her mom in Grenada.
Mhm.
So she was always concerned and wanted to make sure that her mother was okay, and made a lot of trips. So annually, she would visit her mother in Grenada. She also traveled for her work, so she looked forward to those opportunities
Yep.
whenever she could get a chance to see a different country and learn different cultures and customs. She just enjoyed doing those things. But basically, she was a people person. She just liked to be around other people, and she was not one to want to spend time by herself. It was always something that involved someone else. So,
Absolutely. And so tell us about the first day that she entered the hospital and how things started to spiral
okay.
from there.
So I would even go back a little bit to say before that day she got into the hospital, before she went into the emergency room, she had been experiencing these back pains that she was encouraged to go to the emergency room, but she was afraid that she would be kept there. She would be admitted and have an extended stay in the hospital. So her thought was, I would enjoy Thanksgiving and then I will go to the hospital the day after Thanksgiving.
Yeah.
So that's what she did. She didn't drive, and you know she was well enough to be able to take a cab to go. I had to work, and you know it was just constant back pain, but not to the point that she couldn't walk. So she took a cab, went to the emergency room, and she spent hours. I mean, just an entire day in the emergency room. They clearly didn't think of it as an emergency when she was there. I finished my entire day's work and met her in the emergency room. Then they decided to admit her. I think the decision might have been made prior to my arrival, but it took a while before she got a bed on one of the units. And their reason for admitting her was not the back pain. Their reason for admitting her was because her blood pressure was elevated. And so they admitted her to the ICU because her blood pressure was so high that they thought that this is someone who needed close monitoring. And after a few days of her being in the ICU, my mother called me at work and said that she needed me to pick her up because they're about to discharge her. And I was just shocked by that, waiting to hear what is the diagnosis, knowing that this is a lady who had an aortic dissection 6 years prior. So I was very surprised to hear that they were planning to discharge her. And my mother was always very trusting.
Yeah.
So the doctor said this, and I see that with a lot of patients too, because the doctor said this, they don't question. And, you know, she just understood that, well, it's muscular pain, so you can go home. And I asked her, would you mind asking the doctor to give me a call? And surprisingly, he did call me a couple of hours later, I think. After, when I got the call and I was at work, and I explained to him, I'm very surprised that you're planning to discharge her because she had an aortic dissection 6 years ago. Have you figured out what's the problem? Like, my mother lives alone, so it's not like at the time anyone is going to be there to be able to make sure she's okay. And okay, well, this is his response. Let me check to see if I missed something. And I just thought that, you know, without me saying this, she could have just taken a cab and went home without even telling me that he's going to discharge her. And when I went, so he did call me back after some hours later, because this started like 8 o'clock in the morning. So a couple of hours later, he called back and said that he got a second vascular surgeon to consult on her case, and they determined that she really was having another aortic dissection, that every time she complained of pain, it was probably her aorta that was actually dissecting.
Wow.
Yes. So even so, when he mentioned to me that he had planned to discharge her, and I went to see my mother later on that evening, he had left a prescription for Tylenol and Tramadol, as well as a prescription for outpatient physical therapy. To
Mm,
this day, in my mother's belongings, I do have those prescriptions.
wow.
I mean, I could not imagine. They just made that decision because I'm not sure what it is. This was not in her city. She didn't live close to that hospital. She bypassed another hospital thinking that she's going to a really good hospital where she can get good care. And I am wondering, as one of the things, disparities in this healthcare system, they looked at my mother and decided she doesn't live in this area. Why is she here? And that's my
Wow.
opinion about this.
Yeah.
Um, and so yeah, they had planned to discharge her, and then only to find out later on that it was a dissection, and then complications came about later on.
Wow. So just to recap what you just said, the doctor didn't even seem like he paid close attention to what was going on with your mother.
Right.
It was more severe than what they initially thought, and they were going to discharge her and send her back home. And
Mm-hmm.
had you not intervened, who knows what would have happened at that point.
Right. Right.
Wow. So that's just the beginning.
That's just the beginning.
That's just the beginning. And I must say, when I was reading your book, there were just points where I was incredibly frustrated. Like as I was turning the page, I'm reading this and I'm just like, why is this happening? It just seems like simple things were unable to get done.
Right.
So can you tell us a little bit about what you encountered trying to advocate for your mom during this period?
So trying to advocate, first it was after the surgery. My mom, it was decided that the only way to correct this dissection, after they tried to treat her medically and that was not successful, they decided that she needed to have surgery. She did have surgery. There were no surprises.
Yeah.
Everything went well from the procedure. And the pushback started when, after she got extubated from the ventilator. So she was placed on a ventilator after her surgery, or before surgery, she was placed on the ventilator. Then a day after the procedure, they took her off so that she could breathe on her own. I saw my mom that evening. She was able to speak in a very low, hoarse sounding voice, but she was able to speak. She was able to take her medicine by mouth. The next day, I went in and with my mom's friend, I thought that we had walked into the wrong room because there was someone on my mother's bed who looked nothing like her. So this person was swollen. Her tongue was protruding from her mouth. Her lips were huge. Her head was huge. Her entire body, upper body, was swollen. After it was determined that it was my mom, because the nurse apologized, we had to put her back on the ventilator. And then I started questioning, what did she get? What medications did you give her? Because I already knew what her allergies were. Well, one of them, we did not know. She did not know. The doctors didn't know. I didn't know that she was allergic to losartan. So that's a medication that's being used for blood pressure. So they gave her losartan, and it gave her that reaction where her tongue was swollen and all. But she also reacted to heparin. That was another medication that she should not have had because she had a reaction some years before when she had the first dissection, and she mentioned this to the doctors. However, in that moment when I found out, I said, well, why was she on heparin? And when did this happen? There was some miscommunication. The nurse who was in the room was telling me that it happened 9 o'clock in the morning. So this was at noon. I'm walking in. The nurse practitioner comes in, and almost it felt to me as if it was a story that was being covered up. I am being told, no, it just happened, and you didn't get a call because it just happened. And I am asking questions like, does the surgeon know? Is he aware of what's happening with her? Very dismissive. Yes, the surgeon knows, and you didn't get a call because it just happened. So I'm concerned about my mother and the treatment that I'm receiving. So I'm wondering, how are they continuing to treat this lady? So I'm trying to keep calm, but it's scary when you know that the person that you love, this is not what she's supposed to look like. So I'm looking at her, I'm looking at the nurses, and there's no care. That, you can see on their faces, they're not concerned that I am hurt, that I'm worried. There's like a disconnect there completely. So from that moment, I realized I had to keep just paying closer attention to whatever was happening to her at that hospital. Then the next pushback started becoming more and more frequent. As she's swollen, they're reporting to me about medications that they've given her. And it was almost 2 weeks later, she got the same medication again. And I found this out because I started calling the hospital every day while I'm at work. I can't take care of another person's mom or dad when I need to know how my mother is doing as well. So I think on my end, I think my colleagues understood. I believe my employer understood, but I needed to check to make sure my mother was okay. So I called every day, and in one of the calls, the nurse told me, your mom received losartan last night. The nurse did not know that it caused the first reaction, so she gave it to her. But what I realized is there was no accountability. So first of all, she had the first reaction. It should have been reported that she had this reaction. It should have been documented that this is a new allergy for her, so that they would not administer it to her again. However, that did not occur in her case. So as I'm trying to understand this, the nurse, realizing that I am upset, she needed to get off the phone quickly because she does not want to be the recipient of whatever it is that I have to say to her.
Absolutely.
I met with the surgeon, and I mentioned to him that I understood that my mom, and very nonchalant, yes, she won't get it, she won't receive it again. No apology, no, I'm so sorry that your mother is going through this. None whatsoever. Then they gave her, a week later, she received a medication that is known to cause that type of reaction. I don't know that it would have caused the reaction for her. However, if they administered losartan the first time, and it can cause that edema, angioedema for her, why would you administer lisinopril, which is another ACE inhibitor that can cause angioedema? Angioedema is swelling under the skin, usually caused by a reaction to a medication or another agent. She received this medication that her skin, everything, all of the swelling is exposing, is making her more vulnerable for any other infections, anything else that can possibly happen to her. So she received the second medication. I had to ask them, please do not administer this medication to her again. So now they listed those medications, but then by then I became the bad person. So every time I asked or said something, I felt as though they were putting up a wall so that this daughter needs to stand back, do not ask any questions. We cannot tolerate this from you. They started administering her medications for high blood pressure. As they're monitoring the blood pressure, we saw readings in the 200s over 120s, 130s. The normal is 120 over 80.
Wow.
But this is someone who just had heart surgery. And on top of that, she also had strokes. So the blood pressure needed to be maintained close enough to normal. As myself and my mom's friend were visiting, we were asking them, can you please check the blood pressure manually, where the nurse would put the stethoscope in her ears and check on my mother's chest. I'm sorry, not her chest, her arm.
Mm-hmm.
The blood pressure continued to be monitored through the machine, giving those high readings. They had her on about 3 different drips.
Wow.
Eventually, one of the intensivists, this is the doctor in the ICU, called me and asked if he can put in a line. So it's called an arterial line that they put into the arterial vein in her arm so that they can monitor the blood pressure. He called back to let me know that the blood pressure was actually 100 points less than, so where it showed 200s, it was actually low 100s.
Wow.
And she was being treated with all of these blood pressure
Medication.
And then, of course, she started having a lot more complications because of being treated for hypertension. That, yes, she has hypertension, but it was not to that extent.
Yeah.
In that time, her blood pressure was not high. In fact, it was extremely low. She started having more complications where her kidneys became impaired. She had strokes, more than one. She was unable to lift her left arm when she eventually started becoming more awake. And the surgeon started saying, as we were asking him, did she have a stroke? His response was consistent. No, it's the fluid in her arms it's too heavy, that's causing her to not be able to move her arm. Later on, we discovered from the intensivist that it was actually more than one stroke that she had, which prevented her from being able to move that left arm.
So, frustrated again. And I can only imagine what you were going through at the time. So your mom is at this point supposed to be healing from a surgery. And in a perfect world, how long would she have been in the hospital if they had done everything right?
My guess would have been probably a few weeks.
Okay.
And then she would have been transferred to rehab.
And
if everything had done right.
And how long was she in the hospital with all of these other complications that were going on?
Right. So at the acute care hospital, because she spent quite a bit of time away from home, she spent about 4 months, I believe, in the hospital. And then she moved on to the long-term acute care hospital.
Yeah. And every time that I kind of think about your story, what's frustrating to me is you have the medical background to be able to identify these things immediately. And I think about someone like me who doesn't have the medical background, and I don't even know what to ask for. I'm just, it's almost like you're literally in the hands of her caregivers. Like she's literally in their hands because there's nothing that any of us can do but just kind of sit back and watch, like, what is happening here? And as much as you advocate, there's not much else that can be done. So what are some of the things that a person, any one of us who find ourselves in the position of having to advocate for a loved one, what are some things that we can do to kind of help with some of these situations that we might find ourselves in?
So one of the things that I found to be helpful, my mother's organization had a healthcare advocate. So this is someone who can speak on her behalf and speak to the insurance company as well on her behalf. So if ever you learn that your company, if there's someone who can help to navigate through the system, that would be one thing that I would suggest. I mean, she was helping me do some of the things that I was doing, but doing it alone can be very frustrating, very overwhelming, and it takes some of the burden off and some of the questions that I may not have thought of. Then there's someone else, and she also is a nurse. So if there's a healthcare advocate in your organization who can help navigate through the system, that's one way I would say. I would say also to reach out to your Department of Health and ask about resources. Contact the Aging and Disability Services and see what resources there are. But trying to do it alone it's almost impossible. It's a second full-time job, and it's
Absolutely.
not sustainable to be able to function.
Absolutely. And tell us a bit about the insurance part of things that were happening when your mom was sick. What were some of the challenges there?
So one of the things that I found, it helped because I was a case manager. And so I understood some of the benefits that my mother would be able to have. So she needed therapy services. I knew that there would be someone in that job who would be working towards ensuring that she receives those services. But the challenge becomes, I am not the source of information or the formal source of information for the insurance company. So if they are receiving information from an institution that is not providing even quarter of the truth of her story, what is happening with her, they're going off based off the information that they receive, written documentation that they receive from her, from the facilities. So the insurance, my mom's job provided excellent insurance. She had coverage from the acute care hospital all the way to the subacute. She went to 3 different facilities in that 1 year period that she was away from home. And so they provided services, they covered for her services throughout her stay up until the point when it felt as though this was the last straw and she really needed that push and she really needed more therapy and she needed more support. But the facility refused to provide the documentation that showed how well she was progressing, that showed what she was actually able to do. So I became my mother's physical therapist and her occupational therapist. And those are not my areas. I actually got one of my friends on my job who is a physical therapist. So she got her team members to train me on using the physical therapy equipment and how to get my mom to be able to stand and sit and transfer. We were able to do this. The only thing I was not able to do was record it on my phone because I'm one person and I'm trying to push a wheelchair while my mother was walking in the dining room of the facility. But the nurses would come into that room and they would compliment her, how well she was doing. They would give her her medication while she was in there with me. But not one of them documented that she was walking with it. So what was being documented and being sent to the insurance company was that she's bedbound, that she's not able to walk, so she can only go from the wheelchair to the bed. And those are not services that the insurance would pay for. So that's not considered to be skilled needs.
Mhm.
And so the insurance was told she is not participating, she's not progressing. In fact, she should be a long-term care resident, meaning she should continue living at the facility. This should become her new home.
Wow.
Um, so those are challenges. I wish that the insurance company had a way to have sent someone to see how well she was doing at the facility, because my word was just not sufficient. And no matter how much you explain or I explain to them, we even had one of the rehab liaisons, acute care rehab liaison, come to the facility to perform her own assessment and determine whether or not my mother can actually transfer out of this subacute, which means that she will receive rehab if she was approved again to have services 1 hour per day for 5 days a week, whereas in the acute rehab, she can receive 3 hours of therapy, not consecutive, but 3 hours of therapy per day. She deemed her to be approved. She approved her, she accepted her to come to her facility. However, the rehab where my mother was insisted, no, she should be long-term care. She should continue just living, staying in the bed, and not receive services. So that's the bottom line. And I continue to just push and become and work more as a nurse and a physical therapist for her.
And what's so clear from the book is you could just tell the love that you had for your mom and everything that you did for her. You were the advocate when no one else was there. And I think that your mom definitely would have appreciated that. I think she did appreciate that. I guess, what do you hope to get from this book? What do you hope that this book will do for others?
I hope for the healthcare professionals and the individuals and the organizations.
Yeah.
If you realize that there's a family member who is advocating, who is very involved, don't view it as a push against your services, a push against you.
Yeah.
It's teamwork. So the family should be a part of that team. And we all want the same outcome. We all want the patient to survive, to thrive.
Yeah.
But it seemed as though there's a lack of compassion, and I'm not sure what is happening in the healthcare system, that it's a magnet for, without a better way of saying this, but maybe the wrong types of personalities are finding or feeling the need to enter the healthcare system. They have no desire to help others. And this is what we're becoming.
Yep.
We're just becoming a business where it's all about the dollar. So if you cannot afford to just pay out of pocket, then you are no one. And that's my hope, is that the healthcare providers, the system, would realize that there's no win here for anyone, because eventually we're all going to experience some type of disruption in our lives that we'll need to utilize the system in some way. It may not be you, but it may be a friend, it may be another family member, someone you heard of that you have a relationship with in some way. And so don't look at someone and decide that they don't deserve good quality care. It's not your place to make those decisions about anyone. So my hope is that there can be a revamp of this system, the sad thing is my mother is not the first to have experienced some of these issues, these nightmare issues that we went through. And unfortunately, she won't be the last. But I'm just hoping that they'll see the damage that they are doing to our society, how they're hurting people. I mean, a 61-year-old, almost 62, going into a facility for simple back pain that was fixed should not end up with us anymore. I mean, for lack of a better way of saying this, she should have been here still.
Yeah.
So I hope that there's some change, that they realize that it's not always about money. It's about people's lives that you're destroying. And this really was a good person, and you took away so much from me and from many others that she really loved and had good relationships with.
Wow. Thank you. Thank you for sharing your story. Thank you for taking the time to write it. I think it's going to save a lot of lives because it's a powerful read. And I think that everyone should really take the time to read this book. It will help you understand how to advocate for your loved one and fight for them when no one else will. So thank you so much again, Marilyn, for this and sharing your story.
Thank you for having me. And I'm so sorry that you had to have that experience as well.
So maybe we'll have this conversation again or have a follow-up if there are any more questions that people have. So thank you.
Thank you. I would like to see providers not be judgmental toward their patients. If you lack compassion, this is not the line of work for you. Healthcare, it should be about caring, but it's being treated as a business, and I would like to see that change.